Good morning, everyone. Thank you for inviting me here. Before I actually get into the formal part of my presentation, I just wanted to say a little bit about sort of how I got interested in this. Actually was kind of a neighbor of the doctor. I lived in Syracuse, New York for a number of years, and I worked for a program that worked with pregnant and parenting teens. So this is a population that's near and dear to my heart, and that I've had a lot of experience working with one-on-one and direct practice. And it was actually part of what spurred me to go back to graduate school and pursue additional studies. So I'm going to be talking today about some of the research that I've been involved with at Chapin Hall. I'm going to talk about two studies, one which Brenda mentioned, the Midwest study, and another a study of some programs and services that are provided to pregnant and parenting youth who are wards of Illinois. And then I'm going to talk a little bit about some work I've been involved with the Illinois Department of Children and Family Services and their efforts to prevent pregnancy among youth in foster care. So to begin with, we're just going to lay out some context here. As many of you probably know, the pregnancy rate among teens in the U.S. has actually been going down substantially since 1990. Between 1990 and 2006, the teen pregnancy rate here in the U.S. fell 38%. The teen birth rate has also fallen substantially over the past few decades. But despite these downward trends, the risk of teenage pregnancy remains extremely high relative to other industrialized countries. And it's particularly high among several subpopulations. And one of those populations, as we've heard about this morning, is young people in the foster care. So let me just talk a little bit about what we know about teen pregnancy among youth in foster care. Right now, there actually are no national data about the number of young people who become pregnant or who cause another teen to become pregnant while they're in foster care. We have some data will be forthcoming as part of what's called the National Youth and Transition Database. States are now, for the first time, being required to collect data from young people who are in foster care, as well as former foster youth at ages 17, 19, and 21. And a couple of those questions, they don't actually ask about pregnancy, but they do ask, have you given birth or fathered a child? So we will start to have some national data in the coming years. Right now, what we know about this problem comes from a handful of studies. One of the ones that I'm going to talk about in a minute, a couple of other local studies done, but there's, like I said, there's really no national data. We also know that from just a handful of studies, again, that a high percentage of young people in foster care report being sexually active, and among those who do report engaging in sexual activity, many of them also report engaging in unsafe sex. So the study I'm going to talk first about today is the one Brenda mentioned, and has a very long title. We just call it the Midwest study for short. This is a longitudinal study that's been following over 700 young people in Iowa, Wisconsin, and Illinois during their transition out of foster care and into adulthood. We started doing interviews with these young people back when they were about 17 years old, and they were all still in foster care. That was back in 2002, 2003, and we are still following them. In fact, we are just in the middle of our 5th wave of data collection. They're now 25 and 26 years old. And what I'm going to present today is some data that we collected earlier on in the study. So this first slide here shows teen pregnancy and childbearing among the young women in our study. And one of the ways we asked them, had you ever been pregnant, and have you ever given birth? So you can see before their 18th birthday, 29% had been pregnant, 18% had given birth. Now when we asked them, well, have you ever been pregnant or given birth while you were in foster care, the rates are higher. About a third of them had become pregnant while they were in foster care. and about 31% had given birth while they were in foster care, so very high rates. To put those numbers in perspective, we've been using data from what's called the National Longitudinal Study of Adolescent Health. And this is a study that, like our study, has been following a sample of young people over a period of a number of years. And we asked very comparable questions to the questions that these young people were asked. So we're able to compare the numbers for our foster youth population to the numbers in this nationally representative sample of teens. And as you can see, first take pregnancy by age 19, over half of the young women in the Midwest study had been pregnant by age 19, compared to just 20% of young women in the nationally representative sample. So the foster youth were about 2.5 times more likely to have been pregnant by age 19. We also looked at some data on repeat pregnancies. The panel talked about that earlier today. As you can see, among the young women in the foster care sample, 46% who had been pregnant had a subsequent pregnancy by age 19, compared to a little over a third in the nationally representative sample. So not only are the foster youth much more likely to experience a teenage pregnancy, but when they do experience one, they're much more likely to experience a repeat pregnancy. We also have some data on the young men in our study. Again, I'll just put a little caveat here. My guess is that these numbers underestimate the number of the young men in the foster care study who are fathers. Probably some of them don't know that the young women they were partners with had become pregnant. So these numbers are probably really low estimates. But as you can see, 16% of the young men reported that a partner had become pregnant before their 18th, the male's 18th birthday. 6% reported fathering a child. About 16% of the young men in our study reported having gotten a partner pregnant while in foster care, and about 9% reported fathering a child. So again, as I said, these are probably lowball estimates, but this is what they reported. Again, we were able to compare the young men in our study to young men in the general population in the Ad Health study. And again, you see this much higher rates of fatherhood among the males who had been in foster care compared to their peers in the general population. So that was the Midwest study. And now I want to talk a little bit about another project I was involved in. This is a study of the Teen Parenting Service Network. So in Illinois, what we have is a network of service providers. It used to just be in the Chicagoland area. It has since gone statewide. And this is these providers work with all of the pregnant parenting teens in DCFS care. For this study, we interviewed directors of some of these programs and caseworkers, asked them about some of the challenges that they face, and then we also used administrative data, both from the program and from the Department of Children and Family Services, to look at what we could to find out about the experience of these pregnant parenting teens. And we had data on over almost 46,000 pregnant parenting teens that had been in DCFS care between 1998 and 2006. So first I want to talk a little bit about their educational attainment. The majority of these pregnant parenting teens exited foster care with no high school diploma and no GED. Now there were some exceptions. There were some young mothers and fathers in our study who actually had gone on and had a couple of years of college under their belt. But largely speaking, these young people had dropped out of high school and hadn't gotten a GED either. And actually this was, lost the mic. The young men actually were in sort of worse shape than the young women. They were more likely to drop out. They were also twice as likely to have been identified as needing special education services. We also found that a very clear, very strong relationship between repeat pregnancies and dropping out of high school. So for each additional child a young mom had, that reduced her chances of exiting foster care with a high school diploma or GED by nearly a half. So this is another reason to focus on preventing these subsequent pregnancies, is that it really hampers young women's educational attainment. One of the things that the program directors and the direct line workers told us is that they've had some success in getting the pregnant parenting teens that they work with back in school, particularly alternative programs. And then one of the things that they found or actually two of the things that they found were key were, one, having on-site childcare at these programs, and two, actually providing the young women with financial incentives. That was actually something that they found to work. Now, that was sort of their informal impression. There was no evaluation of whether incentives actually increase educational attainment, but that was sort of an impression that they got. But this child care issue, I think, is really important and something to keep in mind. And then to get at one of the issues that many of the panelists talked about this morning, looking at the children of these young mothers and fathers. In Illinois, at least, when a teen in foster care has a child, that child is not automatically a ward of the state. The foster youth actually retains legal custody of that child. However, we recognize that those children are a very vulnerable population and are at high risk of child abuse and neglect. And some of the data that we found supports that. So 22% of the teen moms in our study had an investigation for child abuse and neglect, and 11% had a child placed in foster care. Most of their children were very young when they were placed, and while some of those children were eventually returned to the young mom's custody, many had not been returned to her custody even after 2 years. So sort of this cycle that we talked about earlier today, you could see in these data, the young mom has a child, the child enters the foster care system, and then sort of repeats this whole cycle. We also found that there were several risk factors for the young moms having their children placed in foster care. So the younger the mom was, the more likely she was to have her child placed. Mothers with more than one child were at greater risk of having a child placed in care. And mothers with disabilities or with mental health service needs were also at increased risk of having their children placed in foster care. So in terms of prevention and targeting, those are some of the characteristics of the young moms who seem to be at greatest risk. So now I want to turn to a couple of other issues. So how can we prevent teen pregnancy among this population? Well, there is a curriculum out there. It's called Power Through Choices, and it's actually the only pregnancy prevention curriculum that's designed specifically for youth in foster care. It's currently, it just finished undergoing some substantial revisions. I haven't actually seen the revised version yet. And there is currently an ongoing evaluation to see if it actually does reduce pregnancy among youth in foster care. But that's the only curriculum out there right now. We know that access to condoms and contraceptives is a necessary thing for this population. And making sure that young people are aware of where they can get these things and making sure that they have a way of accessing them is very important. However, I would argue that we could provide these young people with birth control, and make sure they all have access to birth control and make sure, but that's just not going to be enough. That's not going to solve the problem. As someone mentioned this morning, there's these root causes that also have to be addressed. And I would argue that a number of these root causes, I'm going to talk about a couple of them right now, but these are factors that I think motivate the young women, particularly in foster care, that we see causing them to become pregnant. So one, there's this desire to create a family of one's own. So these young people were removed from their homes. Many of them, some of them still have connections to their birth families, others don't, and there's this real strong desire to have a family of their own. Second is this desire to have someone to love or be loved by. I think earlier today someone put up a slide about Maslow's hierarchy of needs and this issue of needing to be loved, and wanting to be loved, I think, is really critical. Also, we've heard young women talk about a desire to prove that they can be a good parent. So they know that their parents made mistakes, and there's this desire to demonstrate that they can do better. And then finally, this, there's also this sort of a perverse incentive that some of the people that work with this population have talked about, is that many of the young girls in foster care will see that if they become pregnant and have a baby, they get all of these services and all of these additional things become available to them, all these special services and supports. And that in some sense, that actually becomes an attractive option. So I think it's really important to think about, we need to provide these services and supports, but we don't want that to be an incentive for young people to become pregnant and have a child. So finally, I want to talk a little bit about some of the work that I've been doing with DCFS in their efforts to prevent pregnancy among youth in foster care. So Illinois is one of 8 states working with the national campaign on this issue of teen pregnancy. They've been doing this since back in, they've been doing this for a number of years, and back in 2009, they set up a formal work group, which I've been a part of, to come up with a set of policy and practice recommendations about how they could reduce this problem. So this was a very diverse group. It included representatives from the Department of Children and Family Services, from other state agencies, as well as local nonprofit organizations. And the mission statement of this group was to help youth in care delay pregnancy and parenthood, and to help those who are already parents delay future pregnancies. So we were very clear, and we used these words very intentionally. We used the word delay. We didn't say prevent, because we didn't want the young women to think we were telling them that they should never become parents. What we wanted to get the message across was that it's great to become a parent when you're ready. So that's why we specifically used that word delay in our mission statement. So what we did was we had 3 sort of subgroups, each addressing this issue from a different angle. We had a curriculum and promising practices work group. We reviewed curricula for youth, for caseworkers, foster parents. We looked at peer education programs. There was a policy and procedures subcommittee. They looked at how we might modify some of the policies, particularly those regarding provision of sexual health care to youth in DCFS custody. And finally, there was an innovative strategies subcommittee, and we looked at how how DCFS could incorporate pregnancy prevention into case planning, as well as the use of incentives and technology. So I want to just highlight some of the recommendations that the committee came up with. So the first one is the need for different strategies for youth in different placement settings. So in particular, this came up with around the issue of how a state, or in your case, how a city might implement a curriculum such as Power Through Choices. We felt that sort of curriculum would work very well in kind of congregate care situations, group homes, residential treatment facilities, or transitional living programs, so you have a lot of young people together in one place. We didn't think that approach was going to work so well with youth in foster homes. Particularly, Illinois is a very large state. It has both urban, you're probably very familiar with the urban areas in Illinois, but we actually have a lot of rural areas. And implementing this kind of curriculum with youth who are, miles and miles apart in foster homes in these rural areas could be really difficult. So we thought that, we needed a different strategy for young people in that situation. And we thought one approach that might work very well would be to involve foster youth in community-based peer education programs that we have in Illinois. We also really looked at the need for training for foster parents and caseworkers. Right now there's no formal curriculums out there. A lot of states and localities are doing things on a sort of individual basis, but no formal curriculums that have been evaluated. And this is a real great need right now. Training foster parents, several panelists mentioned how difficult talking about these issues is. So training for foster parents, training for caseworkers. The idea of integrating pregnancy prevention into case planning, again, this really goes back to training caseworkers, but actually making this an explicit part of case planning during those transition plans that people talked about this morning, talking about contraception, sexual health in general. And then finally, we thought that there needed to be some changes to the existing policies and procedures regarding sexual health and access to reproductive health care services in Illinois. And so those are also being implemented. So I'm going to end my remarks there, and I'm happy to take questions.